Okay, done. Hi everyone. Welcome to today's webinar from Onus Robotic Hospital. The topic is hernia in women and children. So, why it is very much important? Hernia, it can be diagnosed easily in men and older adults, but it is very much difficult to diagnose hernia in women and children. So why? What are the hidden symptoms and how to diagnose it our home itself or with small investigations and to get rid of this problem. So that all things we'll see today in this webinar session. So an essential awareness session for every parent and woman. So hernias, what exactly are hernias? Hernia is a defect. We have normally natural defects at some areas in the body like umbilicus or inguinal regions that we call as groin regions, lumbar regions. So these are natural defects. Whenever the defect size increases, some intestine or omentum, whichever the tissue present inside the abdomen, say call it as intestine. You can see here, this is intestine. So this is an umbilical hernia. Umbilicus will be here. The intestine is entering into this defect. This is what we call as hernia. So hernias are often misunderstood frequently and missed frequently in women and children. Most symptoms appear subtle, confusing. So people may miss hernia and mainly in women and children. So early detection prevents complications and emergency surgeries. Why hernia is an emergency situation? See, hernia is like a bomb. So if someone carries a bomb in some pocket, how does that feel? It is so much dangerous and complication, right? In the same way, hernia is like a bomb. Why? Because the content which is entering into the defect, it may come back to its original position for some days, but on some or the other day, it may not come back. It may struck here itself, which will lead to obstruction of the intestine or strangulation of the intestine. So, what is obstruction? So whatever the content present in the intestine, it may not go down. It may not come out as a stool. Because of this, what happens? There will be abdominal distension. They may not pass stool. There will be constipation issues. Or if there is strangulation, what is strangulation? Strangulation is loss of blood supply to the entering intestine. Whichever intestine entering into this defect, there will be loss of blood supply. Why? Because of this constriction. So this part of the intestine, this part of the hernial content may become gangrenous. This is what is called as strangulation. So this, to avoid this sort of complications, mainly in women and children, we need to detect hernia as early as possible. This session aims to simplify diagnosis, signs, risk factors, and modern treatments concerning to hernia. So what is hernia? We have already discussed. Hernia occurs when an internal organ or tissue pushes through a weak spot in the muscles. The common hernias may occur at these places in the body like groin region, belly button that we call it as umbilicus, then upper abdomen, that is epigastric hernia, and diaphragm region. This is we call as diaphragmatic hernia. So hernias can be silent or mildly symptomatic for months or years. So they may be silent. So you may think that I am carrying this hernia for years together. Now what is going to happen? But suddenly what happens? It may go and obstruct the intestine or whatever the organ entered into that hernia. This is what we see in our clinical practice, that they carry that hernia for years together, and suddenly they land up in the emergency room, like with severe pain, vomitings, and loss of passage of stool from like for last 3 days, 4 days, or 5 days. So why hernias are missed in women? So these may be masked. Hernial symptoms or swellings may be masked with urinary infections or ovarian cysts or pelvic pain or pelvic inflammatory diseases. So they may take them as lightly because they experience this pelvic pain frequently, especially women, because of like menstrual history or menstrual problems or endometriosis. So they think that it is like daily or monthly pain sort of thing. So they'll neglect that pain or that swelling. So groin hernias are often internal and not visibly bulging like men in women. So in women, they are not visibly bulging. So femoral hernias in women are commonly overlooked and can be dangerous. So mainly females have mostly femoral hernias. These femoral hernias are commonly overlooked and can be dangerous. So ultrasound or scans may not always detect early hernias. If it is an early hernia, they may be missed in ultrasounds. Women may undergo ultrasounds frequently for pelvic pains or PCOD issues, but that ultrasound may miss these hernias if they are in the early stages. So common type of hernias in women are inguinal hernia, femoral hernia, umbilical hernia, incisional hernias. What are incisional hernias? Women undergo cesarean sections and maybe hysterectomies in some patients, lap are open. So what is incisional hernia? Whenever someone undergoes surgery, that cut part is again sutured, right? So if the sutured part is not properly healed, or if the abdominal wall muscles are weak, then there is high chance that hernia may occur in that suture site, that cut region. Like it may happen immediately, it may happen in 1 month, 2 months, 6 months, or after years of the operation. So this is what we call as incisional hernia. So mainly women, they neglect this incisional hernia because one important reason is after pregnancy, their abdominal fat, their abdominal muscles or abdominal wall is so much weak. They will have this like the abdomen will be so much weak and it will hang over the abdomen. Okay, so that swelling, that incisional hernia swelling may miss sometimes because of this hanging of the fat or abdominal wall layers. This may cover up the incisional hernia or umbilical hernia or inguinal pelvic femoral groin hernias in females. This is the most important quite common issues we'll see in our clinical practice. So hidden symptoms in women most people miss are unexplained lower abdominal or pelvic pain. They will have this pain from months together, but no one will examine for the hernia because the abdomen will cover the inguinal region. That fat will go down and cover the inguinal region. No one will examine that groin region in females. Especially if they have pain, they go to physicians or nearby practitioners. These practitioners, mostly they will be male practitioners. These male practitioners, they will not examine the woman first of all. Second, even if they examine the woman, They will not see for the groin region. This is the second. Third, if they have incisional hernia, that will be masked with this hanging fat. So they will not examine this as well. Only a surgeon who knows the importance of hernia, who suspects hernia in women, will examine all these things. So sharp pain during standing, lifting, coughing, or walking, burning sensation in groin, chronic bloating or indigestion issues, pain mistaken for menstrual cramps, back pain radiating to groin, bulge that appears only when standing or straining, pain during exercise or long walking. These are all the hidden symptoms in women most people miss. So hernias in children, now coming to the children's part, why they are missed. One, children will not explain or express their symptoms or signs. Okay, kids do not express. Second, bulge may appear only during crying or straining. Only if the kid cries, the bulge may appear. So most of the time they may not cry, so they may not strain. Even if they cry or strain, parents may miss this swelling. So my advice mainly to parents is to look after these swellings or these pelvic areas or groin areas regularly or frequently in kids. Ask them to cough or strain, or whenever they're passing stool, just have a look at their groin regions so that if you can see any swellings at that region, one at the umbilical region, two groin regions. These are the most common and important structures are to be seen in the abdomen of the kids. So symptoms often mistaken for colic or gas pain. Many parents assume the swelling will go away on its own. Many parents think that this is a common swelling, it may subside, but it will not. So common types of hernias in children are, as we discussed, inguinal hernia, umbilical hernia, epigastric and hiatal hernia are bit rare, but most important, two important hernias are inguinal and umbilical hernia. So hidden symptoms in children most parents miss. One is intermittent swelling in groin or scrotum. If a parent sees that the swelling the swelling appears in the groin and it is going back immediately after coughing, then you suspect it as a hernia. Crying episodes during feeding or movement. Whenever you are feeding your kid, the kid is crying, then suspect an hernia. Bulge while coughing, crying, or laughing, because hernia happens whenever there is a strain or whenever there is increase in abdominal pressure. So coughing, crying, and laughing creates some sort of abdominal pressure which leads to hernia. So that hernia will be seen only during that episode, coughing, crying, or laughing. Sudden stomach pain. If a kid has sudden stomach pain, then suspect hernia. Recurrent vomiting, restlessness or pulling legs to chest, swelling that disappears during sleep. So these are the hidden symptoms in children most parents will miss. Parents have to concentrate on this type of issues. So risk factors in women: pregnancy, obesity, chronic cough, constipation, heavy weight lifting, previous abdominal surgeries as we discussed like cesarean sections or hysterectomies, and weak abdominal wall muscles. These are the risk factors in women. Now, coming to the risk factors in children: preterm birth, low birth weight, because abdominal wall will not be formed properly. Family history of hernias. This is one important thing people will miss. And persistent cough. The kid may have allergic issues or chronic cough issues or TB sort of things. In such patients, in such kids, there is high chance they may have hernia. Straining during stooling and congenital muscle weakness disorders. So complications of ignoring hernias, as we discussed, there will be, it may be irreducible, it may become obstructed, so strangulated. That means the blood supply may decrease, severe pain and vomiting, emergency surgery requirement, and the obstructed intestine may undergo infection or gangrenous sometimes, and long recovery period compared to early repair. These are the complications mainly happen in women and kids just because of unawareness of this type of issues. So how to check for hernias at home? For women, stand and cuff gently. Observe any pain or pulling in groin or abdomen. Check for bulges while standing or lifting. Check the bulges while standing or lifting any weights. Notice discomfort after meals or long standing. So these are the important things to be seen for women. For children, observe groin swelling during crying. Second is look for belly button bulge during strain. So notice any sudden crying episodes. Check for swelling that reduces when lying down. So diagnosis, how doctors confirm it is like mainly by physical examination. I will examine my patient properly. Even if she is a female, a female sister will be beside me and will examine the umbilical region, belly button region, groin regions, pelvic regions. Only then we will it will be clear that the he or she may not be having hernias. This is how we will confirm. So physical examination is very much important. Second is ultrasonography. Third, CT scan for major hernias like incisional hernias. High resolution ultrasonography is the most important tool here. So modern treatment, we have laparoscopic repairs. We treat hernias through laparoscopy and even robotics nowadays. So keyhole, minimal pain, quick recovery, laser assisted surgery, sometimes mesh repair we will do. Non-mesh repair for kids. Kids may not need mesh because their abdominal wall will be strength, will compared to men. Their wall will be become strengthened immediately or in the future days. Painless daycare surgery. So recovery and aftercare, walk within hours after surgery because it is a laparoscopic surgery. Daily activities will be can be started in 1 to 3 days. Avoid heavy weight lifting for a few weeks. Simple home care and diet. Follow up for long lasting results. So prevention tips for women and mothers: maintain healthy weight, strengthen core muscles, avoid lifting heavy weights improperly, treat constipation and chronic cough. Post surgery abdominal wall care is very much important. After pregnancy, do guided abdominal strengthening. These are the prevention tips for women and mother. When to seek medical help immediately is whenever there is a severe pain or vomitings. If someone is not passing stool, if there is redness over the swelling, if there is fever or child crying uncontrollably with groin swelling, any sudden persistent pain, all these need medical advice. So conclusion is hernias are common but highly treatable when diagnosed early. Awareness is the key to prevention or preventing complications. Women and children deserve timely recognition and modern painless treatment options. So, my suggestion to all women, all men as well, and all parents. So, men, try to look at the women's pelvic region, groin region, umbilical region frequently to rule out hernias. Second, one more important thing to look for men in women is breast examination. Do it regularly, mainly because this suggestion is for husbands. I want to suggest so regular self breast examination or breast examination. In this way, you can help your spouse preventing two important cancers. One is breast cancer, and second thing is these type of pathologies like uh, hernias, incisional hernias, groin hernias. These you can rule out. So for women, do self breast examination. One, this is out of the box, but I am explaining in this webinar. Second is check regularly your umbilical region. Check for swellings. So start doing some cuff and straining type of things. Then check for the swellings in the abdomen or groin regions. And for parents, look at the pelvic region of your kids. Ask them to cuff or strain and look for any swellings or pain. And if someone is suffering from such type of things, Reach your doctor as early as possible. And I am myself Dr. Raghuteja, laser and laparoscopic surgeon working at Onus Robotic Hospital. I am there to treat these type of pathologies anytime. And even if it is emergency, I am available here 24 hours. You can contact me anytime. Thank you so much. So this is today's webinar. I hope this is helpful. Thank you so much. Bye bye. We'll see you with another webinar shortly. Bye.